Hey guys, Don here. I want to talk a little bit about the application and action plan on this interview from Dr. Bill McCann. I've known Bill for many years, and he is really good at doing in-office dispensing. When I went to his practice, he had a kind of a lot of unique things that could be applied. But I want to start just before we get into in-office dispensing and doing durable medical equipment. I want you to be sure that really the key is kind of going slow and getting used to doing kind of one thing at a time. That's my opinion. You can kind of go all into it and then you really don't do anything. It's called the 80-20 rule. 80% of your revenue is going to come from 20% of the products. And you may already be doing a few of these. You may already be doing custom orthotics and doing other types of things. But I want to give you some real tips. Okay, first you have to believe in the product. If the product is crap, you're not going to be able to recommend it to your patients. You're going to recommend it and they're going to be dissatisfied. They're going to be frustrated. That can be with other products. That can be with what types of treatments you're doing. If you don't believe in shockwave, you're not going to do it. If you don't believe in ultrasound or amnio or cortisone or anything like that, you're not going to be able to do it. So the first thing is you have to believe in it. Many times even trying it on yourself can help. I brought one of these creams home for my wife to try, and she really, really liked it. And so I was like, wow, okay, that was good. Or she had a matrixectomy by my partner, and so I can see, well, that really worked. And so that's the first thing. One of the big struggles, I think, is how to present this to patients because we get a little overwhelmed. And at the end of this podcast, I'm going to talk about one of my kind of biggest aha moments of how to present these to patients in a very easy, systematic way without overwhelming yourself or overwhelming them. And that's like by far the best thing that I've learned. But I'll share that at the end. Okay, so let's talk about it. One of the benefits of doing in-office dispensing is that you're going to increase compliance. Many times we tell our patients and we prescribe even an antifungal, they're not going to use it. They're not going to go get it. And a lot of times things that we prescribe to the pharmacy, they won't get. If it's inconvenient, if it takes one extra step, they're not going to do it. And that's why even a lot of times that we've been talking a lot about these books I recommend, I'm thinking about just carrying them in the office and selling them there because it's easier. I know they're going to at least be closer to reading the book if I get it in their hands before they leave, or if we get that cream in their hands, they're going to be more likely to use it. Another good thing is to make sure that when they use it, the best way to increase compliance. There was a lecture I watched about a dermatologist, and they said, they know cortisone creams work for a lot of dermatitis and eczemas and psoriasis on the feet or other places. And they said by far the best thing to increase compliance is one thing, is have them come back sooner. So if you can have them come back every single day, it's going to increase compliance because there's an actual curve that they use it more when they get it and more right before they come back. So that's the key. If you want to increase compliance, have them come in or have a telephone check with your office manager or someone call them on the phone or send them an email to comply to make sure that they're doing it. That's the main key to increase usage of these things to get better results. And the other tip that he mentioned was the recurring purchase. That's something I really haven't figured out how to do. I would love to do it, and I'm still trying to figure out how to do it. Yes, they come in, they might keep buying creams. We have some of the Amerigel products. They work well, the foot lotions or the urea creams and things like that. But I haven't really found anything, and I don't really feel comfortable doing these medications or these neutral supplements or things like that are going to constantly be coming back. I just don't feel comfortable doing that, so I don't do any of those. Maybe I'm missing out. I'd like to hear what you guys have to say about that. If it's really working for you, please let me know, and we can even talk about it, or I can interview you about it. So I haven't found anything really good for recurrence. But getting more poles in the water, I think, is one thing. But in my personal experience in the past, I was really struggled because I had like 5 billion things I was offering my patients, and I was tending to offer them the $2 pad, and I wasn't doing the $500 orthotic because it takes just as much time. If you're limited on time, the pad, I know Bill said don't give them away, but if you're working more towards the orthotic, it's a better use of your time to talk about that. So I think there is a principle. Yes, you need more poles in the water, but you need to choose which ones you're going to do and how you can automate that. So for example, after an ingrown toenail, I don't even talk about the Amerigel post-op kit because my staff does that. It's something they sign. It's all kind of set out. So the less you need to talk about things, the better. So I recommend night splints and things like that. And then my staff does everything else. So that's a key. But then getting rid of things that you're not doing. So if there are certain types of creams or lotions or things that are just taking up inventory, taking up place in your office, get rid of it or get used to using it or give it away or something like that. You have to get used to using these things. So a few things he mentioned, which we use in our office: the Marigel kits, the urea creams, the moisturizers, the pads. We don't have any over-the-counter inserts. We just do custom insoles. Basically, if there's only one option I have, that's the only thing I do. That's why I don't have any over-the-counter. I know some people's I might be missing out, but for us, it works much better doing the custom ones. And then pads and spacers and things like that. We also do a couple of interesting things. I'll put links in the bottom of this podcast. We do correctos, and those are really good for people that aren't ready for surgery and want to do kind of the most natural thing for their feet. And we also sell a type of anatomic shoe called Lems. We sell those in the office as well. If you want or don't want to do anything on your own, you do an influencer's account on Amazon. I'll put a little link to mine so you can see mine. I send this out to patients. I don't make much. I think last month, a couple of bucks. And then if you want to set yours up, you can do that. And there's also some other places that do it for you. One's called DocShop Pro. They can do this all for you. So the tip I was going to say at the end, by far the best thing for me in doing in-office dispensing and durable medical equipment has been doing my patient presentations. Basically, what I do in the main slide that's the best in these presentations, basically it's a PowerPoint presentation that I put together. And one of the slides is a checklist slide of all the different treatment options. And on there, I have like pads, correctos, all these other types of things that these patients are going to need. And I kind of go through it with them and I say, well, in your specific case, I recommend this and this and this. So it's really easy. If you want to add something, you just add a slide about it or you add it to your checklist. It works really, really slick. I'm going to put a link to the patient presentations. Basically, it's a notification link because I'm putting together this course on patient presentations, but I want to see if anyone's interested in it first. So I'm going to put a little link down there. I'll notify you when it gets going if you're interested in that course. Okay. Once again, thank you for listening. If you want to join one of the other group sessions within Podiatry Practice Mastery or look at the archives or get access to the interviews, I'll put a couple of links underneath here as well. If you have your own question, please send me a question. Okay, great. Thanks, guys. Have a good day.